Hello beautiful people, welcome back to another reaction video. It's been a while since I created a reaction video. I think the last one that I created I was still in college. I usually like creating such kind of videos. Number one is just to clear things up, because I usually create reaction videos that are in line with nursing and KMTC. So number one is to clear up things, especially for the upcoming nurses, so that you just don't get confused in all the things that people are saying about nursing and KMTC and blah blah blah. Another thing is just because they're just so funny. So today's reaction videos are from something that trended a couple of days ago, and it was people trying to compare KMTC nurses and bscN nurses, and I think this is an argument that will never end, and I don't know who will ever stop this argument once and for all. But yeah, let's get to see what people are saying about this. Before I start, if you're new here, my name is Loise Oduor, and on this channel I talk about nursing. I also do lifestyle vlogs, and I also talk about health, that is mental health and sexual health. Like I usually like covering about family planning, and apart from that I also do talk about self-development. So if that's something you're interested in, make sure that you consider subscribing and be part of the family. So the first person you're going to read the comment from, who is Professor Marco Wing, I don't know, but he's saying, I know the animosity between KMTC and bscNs will continue for decades, but I don't care. Just giving credit where it's due. Bachelor students remain the best brains around. 90% of KMTC students are average performers, cutting corners to become doctors, period. So this is something that I hear a lot, people saying that KMTC students are average students or low performing students from high school. But that is not true, because like if I talk about myself personally, I got a B plane and I got a chance to go to the university, but I never wanted to do the course that I was called to do in the university. So it's not that we are not capable of going to the university, because nowadays, remember, even if you have money, no matter the grade that you have, you can still go to the university. But then why is it that you're just going to the university to study anything for the sake of going to the university and feeling like an A student, and yet you are not feeling fulfilled in terms of your career? So for me, I just chose to do the career that I want, not because of the grade I got or because I'm an average student. Yes, you'll find a bigger percentage of those students who are there average students, but that is not something to define someone to be a better nurse or something like that. So someone here, Ian, is saying, have you ever come across a casual worker who practically knows how to dress a wound or even cannulate? It takes eyes and compassion to be effective, not KMTC versus bscN. This is so damn true. Like, have you ever been to these hospitals whereby you'd confuse the casual workers like with nurses? Because you'll get to that hospital and they'll do most of the things. They'll even at times, when they're on their night shift, they'll end up helping the nurses, and you'll end up thinking they're the nurse. It's because nursing is a skill and you learn it from experience. It's not which college you went to or which university you went to. It's not about which books you read. It's not about the A you got in high school or the C you got in high school. It's not about that. It's about the experience you get and the attitude you have. Because you might have read all the books, you might have gotten all the A's, but you are not compassionate, you don't have the right attitude, you don't even have the skills to do your work well, you cannot cannulate, you cannot do these things, you cannot cannulate, you cannot even dress a wound. You see, it's the experience that matters, that really makes you a better nurse. So being a KMTC or a bscN like doesn't really matter that much. Someone else here is saying that that rebel was saying that because they only want to misuse them and pay them extremely low. So this thing about KMTC students allowing themselves to be paid extremely low, I think we talked about this in the interview I had with Mr. Ngalula, and what we came to agree was that, you know, for lights just went out, so I'm just gonna use my phone. So what we agree was that you find that most degree students, they go through internship and they get paid. So by the time they start working, they already know how much they should be paid, like they already know their worth. But you find that most diploma students, they go into the job sector immediately after college. And so imagine this is a person who has never like tested like kuonja ile salary yake tested kuonja ile salary yake. So the moment you start paying them even 20 something or 30, like they'll be so happy, because they'll be like, I've never been paid 30,000 like ever. So that's why we find that most of them usually accept that low. Yeah. The person asked, then why are they rushing to upgrade the academics in the university? When it comes to upgrading, you don't upgrade only because you feel like you're going to be better after upgrading. She replied about checkbook. Yeah, you're going to upgrade because you'll increase your job group, you'll be able to be paid higher, and also increase your knowledge. Yeah, that's just it. Someone else said, the problem is the government of Kenya has failed to hire these productive people. Instead, they're the majority giving care in foreign countries. Yeah, that is so true. Most nurses are moving to other foreign countries nowadays so that they can get better pay and better job working areas, because you find that you're not being paid well. The working conditions is just so poor. Like, there are so many disadvantages of just working as a nurse in this country than working in another country. So just prefer to move on to another country, get a better pay with a good working environment. Yeah, that is why most nurses are moving nowadays. And yeah, it is because the government has really failed. The person saying, wewe kama ulisomea KMTC endelea kuota na hizo vitu. Karibu waniulie my loved one. Very incompetent people wako na madharau sana. So when it comes to being competent as a nurse, you find that it is not about where you went to school to. It's about your own attitude as an individual, because you can testify to this, that we have good nurses. But you find that a bigger percentage of the reason as to why they are different, it depends with where you are, because you find that is these hospitals that we have incompetent people now kuna madharau sana. You'll find that most of these hospitals are public hospitals and the Kanjo hospitals. They're the ones who have a bigger percentage of these nurses. You won't find them in private hospitals. Why? Because in private, you're being paid well, and apart from being paid well, you should be accountable. Like, even if a patient tells you to do this and this and you are not able to do it, just know if you can be sacked from your job like even as early as tomorrow. So like, you cannot take some kind of incompetencies in private hospitals. But in public hospitals, they feel like they're so free, they can do anything they want, no one is following as much. And also they have the bitterness, like they're not being paid, the working environment is so bad. So with all that bitterness, they also have that attitude that makes them incompetent. Yeah. And then someone was also saying about sema tu you're looking for cheap labor. Yeah, they was saying most people believe that KMTC students offer cheap labor because they'll accept that much of a lower salary. And when we are talking with Ngalula, we'll try talking to you guys and telling you should know your rights, you should know how much you are worth. Like, if you feel like this is not enough according to the job you are doing, you have a right to talk. And that is why we are really trying to advocate for new nurses, new grad nurses, to really know like how much they should be paid. Because when you go to a job interview and you even really don't have an idea of how much a nurse is usually paid, then you cannot really argue out a lot. You cannot even try to negotiate a lot because you have no idea. So try and have an idea. Try talking to other nurses. Like, just try. Another person is saying, I only agree in basis of practical. KMTC nurses are better than university ones, like practically. I don't know, but this is usually somehow true because of what I've heard from the bscN nurses, the ones that we were on our attachment practicals. But that doesn't mean they won't learn. Yeah, because nothing is a matter of practice. Even if you, like, let's say I'm in KMTC and I went for that attachment for 2 months, when they get to that job sector and they work there for 2 months, they'll be able to get the skills they need to be able to work in that place. So them KMTC nurses having to do much practically, the way they say, doesn't really affect it in such a way that you say that they are more competent than the bscN nurses. because yeah, it is a matter of experience. You can do it for 2 months and you haven't like learned how to do it so well. So yeah. The other one, there's this video about nursing students who I think they were dancing that song about the dream. How is that? I can't remember. But then someone saying, you prefer this, acha tu niende kwa mganga. So people, I remember when I watched this video on TikTok, people are like, you as nurses, you're not supposed to be dancing, you're supposed to be working. Like, that is why I cannot go to like public hospitals, because if these are the people who are going to treat me. And I was like, why are you guys so bitter? Does it mean that the fact that you have gone to nursing school, you're supposed to be serious with your life, you're not supposed to be dancing, you're not supposed to be enjoying, you're supposed to be focused, because that is the only way you're going to become a good nurse? No, that's not it. You know, the only mistake that they make is that they dance with their uniform, and so people are able to notice that they're kmtc students. But I'm telling you, if they decided to dance without this uniform, you wouldn't have noticed that they're kmtc students, that oh, they're going to do their work incompetently only because they're dancing. Just take it that everyone has a life, that apart from working and being a nurse, or being whichever person you are, depending on the career you are taking, you have a life. There's life outside just being a nurse, or being a doctor, or an engineer, or a lawyer, or a whatever thing that you're doing. Yeah, and that is why you find that most of them are usually having this kind of bitterness with life. Like, I've worked with so many nurses who kind of have a certain bitterness with life, and they feel like they don't have to enjoy life, they just have to go to work each and every day 24/7. It's because people just want them to be like that. Just know that you have a life. There's a life away from work. You need to enjoy, you need to dance, you need to meet, you need to do all those things. There's a life away from working. Yeah. Okay, someone is saying again, it's your opinion, choice, and right. Every time you visit hospital, be asking that question. Anyway, degree nurses were never meant to be bedside nurses, but drivers of quality nursing care through the kmtc nurses. So if you say they were never meant to be bedside nurses, what do you mean? Because when it comes to being a bedside nurse or a non-bedside nurse, it's all about your own choice. There are people who really enjoy being bedside nurses, and that is something that they want to do for long. But there are people like me, I really don't like bedside nursing. And it doesn't mean that I have to like bedside nursing because I went to kmtc, or because I did a degree, I'm not meant to do bedside nursing. Like, if you enjoy bedside nursing with a degree, with a diploma, do you. If you don't enjoy that and you want to do another section of nursing, like, just do you, baby girl. Okay, someone is saying kmtc nurses ni wale wa kusema na ngoja doka aseme chenye nafaa kufanyia patient mwenye ni diabetic na ako unresponsive. The same nurses are potential filers. They receive lab results, then file them to wait for daktari hadi afike without any intervention. Someone replied, in this case anafaa kungoja doc. Okay, let me tell you something. When it comes to dealing with your patients, there are things that you can do as a nurse, and there are things that you cannot do as a nurse. There are things that you've been trained to do, and there are things that you haven't been trained to do. So if you have a patient who, let's say, it's an emergency, if you're able to stabilize the patient and the patient is okay until the doctor arrives and checks on the patient's father, then that is just okay. Because the moment you want to do everyone's work, you want to be the nurse, the lab technician, the doctor, you want to do everyone's work, I'm telling you, you'll end up getting into problem. And the moment something happens to that patient, believe you me, it's only you, the nurse, who is going to get into a problem. Like, you're the only one who is going to take responsibility for that patient. They won't care that where was the doctor when you are doing these things, where was the who and who when you're doing these things. Every blame will be placed onto you, and that is why you usually see so many nurses going even to jail and paying really huge amounts in fine, only because they were saying you did this to a patient and you're not supposed to be doing it. And you'd wonder, was she or he the only one who was in that hospital? So if you feel like something is not under your scope, my dear, let someone not tell you that, oh, you don't know what to do and you're a nurse. You're a nurse. Yes, you're a nurse and you're not a doctor. Just get that really, really straight. Okay, someone saying because they failed their high school exams. The reasons why someone is at KMTC is because they didn't attain the cluster to pursue a medical course at the university. Again, I repeat this again. It is not usually just because you couldn't pursue a course at the university. That is not the biggest reason. But what if the course you wanted to do, you weren't able to do it? Like to start from that level. Who says there's a problem to start from a lower level? There's no problem. Like if you want to become a nurse, I usually tell those people who come to me for advice, like you really want to become a nurse, you cannot be able to do a degree. Try a diploma. You cannot be able to do a diploma. Start from certificate. We have really great nurses who started from certificate, upgraded to diploma, and even went to degree. We have some who have just done certificate and that's it, and they are like the best. You won't know until one day you hear a story about them that they only did certificate and be like, what? Because I told you guys, it is not about what you got in high school or which college you went to. Like it's all about how competent are you, how are you dealing with your patients, like what's your attitude. Like that is all that matters. If you want to think that the cluster point and the reason as to why you failed is what is going to make you a good nurse, I'm sorry, like you are really not getting it. People are really getting it the wrong way. So because okay, now like I really don't understand. Because okay, let's say now I failed my high school exams, but I really wanted to become a nurse. So should I just cut out my dream of becoming a nurse because I failed my high school exam? And yet there's a way I can still become a nurse. I can start from certificate. Why don't I just take that advantage and I'll still become a nurse? If I want one day to pursue that medical course at the university, I'll still do it as long as I still have that passion. Okay, the same person is saying, I am made to understand that anyone who goes to KMTC is an academic dwarf. Like, what do you mean? Explain to me why you didn't attend the university cluster to pursue a medical course in the university before you argue with me. It's not like this is just the same thing. It's not about what you attained, the cluster points and or whatever. It's not about that. It's not about you trying to do a medical course at the university. It is not about that. It is about your passion. I'm telling you, you can have a straight A and go to the university and do medicine, but as long as you don't have the passion to do it, I'm telling you, like, you won't be if everyone will notice you are a quack, even if you got that A to get to the university, as long as you don't feel it within you. Imagine a medical courses just come from the heart. It's about the compassion you have to work like to serve. Let me just use the word to serve. The passion that you have to serve. That is all that matters. Whether you have an A, you have a D, I'm telling you, that's just it. Like, I've worked with doctors. Yes, they got an A and they went and did a medical course, but the way you see them dealing with patients is just so poor. So it doesn't matter. I'm telling you, it doesn't matter. Someone is saying 80% of those training at KMTC are qualified to study at the university. It's only that some of them chose not to take useless bachelors and opted for MTC course, which pay much better off. Yeah, someone say this is not true, but I think it's true. Because let's say I got that C, and there's a course that I'm able to do at the university, but I don't feel it. I don't want to do that course. It's a course that I'm so sure I won't even get a job. I've never even heard about that course my entire life. Why should I do it? Why don't I just opt for a course at KMTC or even these polytechnic colleges, and then I do something that I'm sure I have a chance of working somewhere or even creating employment myself? Like, why are people not getting it? Why are people not getting it? Yeah, there's another one here. Intelligence is overrated. If you haven't learned that, it's time you grew up. Yeah, that is so true. Learning slowly, getting to know things over time and through practice is of greater benefit than spending time on books, etc. Yeah. Like nowadays, you having spent, I don't know, 10 years on your books is just nothing. Nowadays is, what ideas do you have? What can you think? Is about being great and pursuing your career. Like, it's not about how many books you've read or how many years you've gone to school or which level of education you've gotten into. You've seen nowadays we are in a generation whereby those who have gone to the universities and did masters and whatever, they are not earning. When you start with, and they're not earning as much, their lifestyle is not getting, you know, there as much as it used to before. It's because people nowadays don't just look at how many books or how intelligent you are, but what you can offer. What is it that you can offer? So yeah, that's why this person is saying intelligence is so overrated. Yeah. And then the other thing is that nurses are really facing a lot of difficulties, I'm telling you. Like, I saw another memo. It was from, is it from Kenyatta University Referral and Research Hospital? Yep. They were saying it was a direction from human resource, and he's saying no public holidays shall be awarded if a holiday falls on your day off. And then they were saying there's a policy that was putting to exempt lactating mothers from night shift. Therefore, necessary adjustments on this effect shall be done on rotas effective November 1st. So they were like, congratulate new mothers and welcome them back to the team after maternity leave. Note that it's not a policy to exempt them from night shift. So I was just thinking to myself when I was reading this, like, imagine you have a newborn and you are going for night shift. Like, guys, these people are going through a lot. Nurses are going through a lot, and we should try that instead of arguing who's better than who, we should try and work on improving such kind of things that are affecting us and making the work area more comfortable for everyone. Like me, I think I've reached a point whereby, I don't know, like, I just don't feel nursing as much as I used to before, because of, yeah, the challenges that we usually go through, and usually hear people going through, and they're like, nah, I can't do this, I can't do this. Yeah. So yeah, that's it, guys. So you can comment down below and tell me what you think about this topic of today, and let's hear your thoughts out. And yeah, let's try and work towards getting better, not towards diminishing each other, making each other feel like someone is better than the other. And yeah, so that was it for today, and see you on my next video. Bye bye.